So my mother was first diagnosed with Paget's shortly after retiring. In her early 60s, she'd led a pretty healthy life, so it came as a bit of a shock to us. But fortunately, there was a vigilant GP who understood what the condition was, and she received some good specialist treatment at a hospital in North Wales. Neither myself or my sister were involved at this time as a carer. She pretty much managed everything herself. Her health was a little bit impaired, some pain management in place, and as a busy family, we were all dispersed around the UK. She pretty much got on and managed it all herself. We all thought that everything was being contained. But of course, now she's into her 70s, there's always a few other medical issues floating around, and they can be a bit distracting. And to our surprise, she had dropped off the radar screen of the local Paget's specialist and hadn't actually been seen by anyone for over 5 years. And as the disease can change and different drugs are around, we were very concerned to get her back into the system. So we had to work our way through quite a bit of bureaucracy, but we got her back into the system and into, if you like, an annual MOT type of situation. So I think one of the biggest issues when people get into the 70s is the fact that there are concurrent conditions. So we were very keen that she would have a specialist looking at her so we can differentiate between Paget's and whatever else was going on. So we were very pleased that we were able to put that in place. So she's into her 80s now. The condition's pretty stable. She recently moved house. No simple thing at that age. We're able to transfer her to another specialist Paget's hospital in Cardiff, which was great news. She's had an annual checkup and has even had an infusion of zoledronic acid, which is the major treatment that can mitigate the pain. So we still come to patient days. They're really helpful, keep us informed, and we immerse ourselves in medical science as carers, both myself and my sister, and hear about all the latest news. So I think in summary that the most important thing for a carer is to feel that you're doing everything possible that you can to get the patient in front of the expert and do that on a regular basis. One thing I would add is that the Paget's Association has been rolling out a major initiative called Centres of Excellence, which is really to recognise all of the specialist hospitals throughout the UK that are real experts in managing this condition, because it is an unusual thing that has a low awareness amongst the general medical community. So if one of your family has that condition and you can navigate your way through a GP, it is actually quite easy now to identify where this expertise is. And it's a fantastic initiative. It means you can get a full diagnosis and receive the right treatment.